Hi everyone, my name is Dr. Nisheta Sachdev and I'm here today to talk to you about MedTech, one of my favorite subjects. So as a crypto and Web3 enthusiast, and I'd say a tech enthusiast, I absolutely love the world of AI and blockchain. And the reason that I fell in love with it so early on is because I saw the need for it in the MedTech space, because at the time I was a practicing dentist. So this little topic is a place of passion for me. The main ways that blockchain and AI can impact the medical field is in terms of patient data storage, telecommunications, telemedicine, drug research and pharmacology, FDA approvals for drugs, data analytics. I mean, you can really get into this little rabbit hole. So I'm just going to touch on some basic points here. First of all, patient data. I'm sure that you have switched doctors at least once in your life. If you haven't, good on you. Lucky doctor. Find a backup as well though. If you have switched doctors, you will find that you generally cannot move your medical records. It can be a lengthy process because your hospital has to communicate with your doctor or vice versa, and that can take sometimes a week, sometimes a month. And if you are extremely unlucky, or if you live in certain countries where these softwares are not fully developed, it might not ever happen. So here's how blockchain fixes it. First of all, it offers a cost-effective way of communicating data. Second of all, it's immutable, which means that no one can really tamper with it. So once you receive a diagnosis, a treatment, or a prescription, it's stored on the blockchain and no one can reverse that. So any doctor can go in and see your medical history from when you were born. Now the third way is, in case with traditional softwares, they're normally stored on a cloud. If there's some technical errors, information can be deleted and then you're stuck and you have no data and no medical history to refer to anymore. So the blockchain fixes this, and I feel like this is going to be one of the biggest game changers once it hits adoption. The only problem here is that we are still too early. Even currently, you're looking at countries like India, and I practiced in India for years, and don't get me wrong, I love the medical system. Some things though are just done very manually. For example, where I was working, all of our patient data was written on cards, and whenever our patients would lose their cards, we'd have to start from scratch and repeat the whole process, go through x-rays again. Also, how are you going to store an x-ray? Realistically, you give the patient your little radiograph and they lose it, or it fades after 3 months. So these are little systems that blockchain can help improve efficiency on. Now, the reason I say that we're too early is because in order for us to even get to blockchain, we need to first adapt technology in these sectors. And there's so many hospitals worldwide that are not there yet. They still rely on these documents and physical writing and signatures and stamps. So once we do move towards a sustainable solution that is easy to adopt, that's when you'll really see the full potential of blockchain in the industry. And let me tell you, it will impact the medical industry worldwide. Because now when you move from the US to, I don't know, Singapore, your medical history is transported and you don't even have to do anything. It's a game changer. And it could save many, many lives. Now, moving on to the next topic, I'd love to talk to you about AI. AI has been a buzzword for the last year, and it's so exciting. Initially, when the medical industry had set these laws in place on how to treat patients, they never really integrated technology into the mix of things. And so now we're seeing that there's like a massive turn in regulations, and regulators are trying to figure out how they can ethically integrate AI into medical treatments. Obviously, you want the human component. Doctors have been through years of education, and you cannot just discount that because of a bot. So here's how AI is helping in terms of speeding up the process of diagnosing, treating, and predicting outcomes of patients. So AI can take patient data and process it within seconds. And you're talking years and years, decades of data of previous treatments, previous cases, previous outcomes, drugs that worked, drugs that didn't work, drug interactions, patient interactions, and predict prognoses of medical conditions that can be quite rare. So in terms of coming up with a diagnosis, the prognosis, it's very easy for AI to take a step in and save so many lives going forward.